And we know that the cerebellum lives down in the lower part, the inferior and posterior part of the occiput. Because it is on the inferior part, it's under the tentorium. So we have the tentorium going across the top. We also have the falx. There's a falx cerebri and a falx cerebelli. So the cerebellum, bottom line, is it's surrounded by a lot of very tough tissue. And it's separated into a left and right side, and it's also separated from the cortex above. So it's basically wrapped in a whole lot of meninges. It can get very compressed. If you have a lot of dural tension, it can absolutely get compressed. If you have a lot of sinus congestion, we have the sinuses that are the air spaces, like our frontal sinus, maxillary sinus, sphenoidal sinuses. We also have the sinuses that are our venous sinuses in the brain. And the two systems are connected. The air space sinuses are a lot about pressure. The venous sinuses are about drainage. And if you don't have sufficient drainage, that increases pressure, right? So oftentimes you'll see folks who have a lot of allergies, inflammation, sinus issues also have problems with drainage from their head, which makes sense. They can't drain, they get congested, stuffed up here. Now, stick with me, we're going here. So we've got the venous sinuses. We know we have the superior sagittal, we have the inferior sagittal, the straight sinus, the transverse sinus. They all come together back here at the inion. And then we know that we're going to drain down the jugulars and hopefully get out of town here, out of the head. Well, who's down here? The cerebellum is down here where all this major coming together is happening. So if you get pressure in the head, and if it's difficult to drain, that pressure is going to be localized around the cerebellum. So that's why it can feel very tight back here. Now we think about what's the cerebellum supposed to do? Well, the cerebellum helps with motor planning, right? And the cerebellum helps with balance. And those things can be adversely affected by a lot of tension in the head, which, as we said before, can come from lack of sinus drainage, lack of venous drainage. Anything that increases the pressure, infection, inflammation in the head, can have a negative effect on the cerebellum. So what all this means is, if you have a lot of tension back here in the cerebellum, make sure it's a balancing act between cerebellum and supporting that and the drainage and wanting to support that. Just like you can have the hippocampus being adversely affected by long-term pressure, lack of movement, and restriction, you can have the cerebellum adversely affected by tension in the meninges, pressure, and lack of venous drainage. And so on page 132, where it talks about clinical relevance, one of the first things is balance disturbances. So cerebellum is about balance. If I'm not having a good sense of dynamic balance, especially with movement, then that's going to point to this area. Posture, gait, so how I hold myself, my resting posture has a lot to do. Tomorrow we're going to talk about the semicircular canals, but that's also coming through this area back here. So when there is compression in the cerebellum, doing these techniques are very helpful, but also think about your venous drainage. So your jugular foramen, the mastoid, the foramen magnum, about opening up this lower area. And bless you, a lot of folks who, they talk about age-related balance issues, a lot of times it's the cerebellum, and it's because they're not draining well. And maybe 9 times out of 10, maybe 8 times out of 10. Somebody without a balance and drainage issues also has sinus problems. They may have allergies, but it's the congestion in the sinus system becomes congestion in the sinus system, or vice versa. and it's a drainage issue, and that can ultimately have a big impact on the cerebellum.